we've got a couple pieces of business to look at today. We have representatives from Stevens here with us, Tom and Claire, and they would like to present us with a mid-year review, which is going to cover the year-to-date claims that y'all received and how we're trending. So if y'all want to just go ahead.
Sure. Yeah, thank you. It's good to see everybody and glad everybody has survived 2020, first quarter of 2021. We do want to kind of review the claims history, and Claire did a really good job of going back multiple years, but I'm not going to go all the way back and cover all of that, but the information is there if you want to review it. I will draw your attention to the red row. If you remember 2019, you were with the MetaHop or something else, then we were not involved at that point, and so there was no history available. So we don't know what really happened in 2019. We did come back in 2020, and you were with Qualchoice, if you remember, in the year 2020. And if you'll look down at the very bottom there in yellow, the claims in 2020, we had medical and pharmacy claims total $1,907,124 versus premium paid by the county and the employees of $1,978,000. And that resulted in a paid loss ratio of 96.4%. So you ask, what is an insurance company really looking for in a paid loss ratio? And what they really would like to see is a number in that low to mid 80s, okay? And because that 96.4 does not include their cost of doing business, administration, any taxes they have to pay, any of their expenses that they have to administer the plan. And so when you're running a 96.4, that's not good. And that's why, if you remember last year, Qualchoice presented a 17% increase because of the loss ratio. And then we were able to go back and get a quote from Cigna and get it reduced to
6.5%, 7%.
6.5%, 7%. So that's, and Qualchoice wouldn't come off the 17 enough that we could stay with them. And that's why we made the change to Cigna January 1 of this year. Now, there was, and hopefully there's not anymore, but just to make sure, the MetaHop plan you had in 2019 was a self-insured type plan that used the Cigna network. Okay, so the people were confused that we were going back to MetaHop because it was Cigna. No, those are two very different things. You're now with Cigna, the insurance company that owns Cigna, the network. But in 2019, MetaHop leased the Cigna network, so you have a list of doctors you could go to. Okay? Does that make any questions about that? So,
the only question I have, I'm on the opposite side. I just, how much prior approval does Cigna require versus the competition, and you're in the insurance business? Prior approval for CTs, MRIs, colonoscopies, those things. The premium is not as important to me as it is the facilitation of what the patient needs.
right.
And I've told these people maybe I'm on the wrong committee because I'm not a premium shopper. I'm a quality service shopper. And when a patient comes to me and I get Cigna, God forbid, hamburger, places like that, and I got a patient that's sick, I have never got a kickback and don't own a CT machine or an MRI machine. And somebody wants medical records sent or somebody's acutely ill, that's really not feasible. And I don't know about Cigna General, but Cigna Medicare is terrible. Cigna Medicare is absolutely terrible from the standpoint of where can the patient go, what's in network, what's out of network. I've got a lady that needs to see an ENT man, and she's got to go to Dyersburg. But the problem is in Dyersburg, there's no ENT doctor, so, you know, I don't even know if that's a fair question.
Well, I can't speak to the Medicare. But I do know some of those Medicare programs, whether it's Cigna, are a lot like HMOs. So they're very managed care, so there's a very tight network. The Cigna plan that the county's with now is a good plan, and it's as good as, Blue Cross, United Healthcare, or QualChoice. But to your point, all of the insurance companies have prior authorization criteria for certain procedures and drugs. Like specialty medications, they're all going to have a PA attached to them. And that's because whether it's Enbrel or Humira or some of these imaging services can be costly. And so we just want to make sure that the service or the prescription, whatever it is appropriate for that patient given the diagnosis.
That's like reaching over and just slapping me in the face.
I'm sorry, I understand, yeah, it's frustrating, but hopefully by doing so, they can control some of the cost. And
Well, again, I repeat what I opened up with. I'm not sitting here to premium shop here. I'm sitting here for quality service to the employees. And,
Well, and we can send, I didn't bring it today, but we can follow up. We actually did a comparison when we moved from QualChoice to Cigna, and there were actually details of the benefit that were better. So it expanded coverage for the employees for like certain diagnostic services were actually lower cost. Even though the general plan was the same, there were quite a few enhancements, and we opened up the network. So Cigna is a national network. So if someone, previously with QualChoice, if they wanted to go to Memphis to receive care, they may or may not be able to do that. Whereas now, if they're a contracted Cigna provider, they can do that.
that's another
So-
thing. We are 55 minutes from Memphis.
Mm-hmm.
We're 65 minutes from Jonesboro. And then the move from Jonesboro to tertiary care is Little Rock. I got people that I take care of who've never been to Little Rock.
Sure.
So it becomes a burden to the family to have someone that has to be in network in Little Rock as opposed to in Tennessee. And doing what I do for a living, I have to take care of the whole family.
Mm-hmm.
I got to worry about daddy's got to stay home and make a living. Child is in the hospital in Little Rock instead of in Memphis. So you can't go see the child at night. Can't go spell mama at night. And I know those things are not in your portfolio, but those are considerations for me
Sure.
and the people that work for this county.
Sure.
yeah, and it's something that I think a lot of Arkansas struggles with because we're a rural state.
That's right, absolutely.
And I think one of the things that they're doing at UAMS in Little Rock is with virtual care. And I think you're going to see more and more of that going forward, whether it's telemedicine or a Zoom call with your doctor, so that somebody in Blytheville doesn't have to physically drive to Little Rock to talk to their physician.
To get substandard care.
It's maybe substandard, but it's care.
It's money driven, and that's
Yeah.
where we're headed. You're absolutely right. But it's very difficult for me to think that I can talk to you on the telephone or on a TV screen and not touch you and do as good a job as I can if you're sitting there looking at me. But
I
today's
agree.
world, guys, people that are my children and grandchildren's age think the boob tube's the way to do it, but I don't want to be part of the malpractice insurance business.
Well, you think about it, the time that you spend driving to and from the doctor's office, the time in the waiting room.
60 miles one way sometimes to get to a doctor in this county.
Yeah.
I understand that. I do understand that, and I guess a little bit beats nothing. I agree with that, but let's don't put them on the same level at the same time.
No.
And say that we're doing quality health care. I don't think you can get anybody like
There are
this.
some things I think that people still need to have that in-person visit. But what we saw last year with the fear people had
That's right.
of going to the doctor and getting COVID. My father-in-law took my mother-in-law to the emergency room because she had back pain. He's 87 years old. He got COVID. And thank God he survived it.
But you took the lesser of two evils there. You didn't go because of ambulation. Let's just say they're homebound. And there's pitfalls to that. They're homebound, tell them that it's fine. But when it comes down to serious illness, tell them that shortchanges the patient.
Well, it's not for everything, but for some things.
Comparatively speaking, something beats nothing. I do believe.
So those are all obviously things that whether you're with Cigna, Qual Choice, Blue Cross, United Healthcare, Humana, whoever, there are some things that we don't like as well.
I guess what I'm getting at, you will help us understand the limitation of whatever
Exactly.
insurance.
Yeah.
Okay.
And if anybody ever has a problem with a prior authorization or something, and we had a situation that we worked through to get a PA, if I remember, it wasn't that long ago.
Yeah, I mean, it's been helpful when we reach out to you to do stuff like that.
So that's what Claire's there for.
Yeah, I need Claire.
But I
I
can.
need your cell phone.
I need I've already had problems already.
Yeah,
Well, I'll
and
keep my
she's,
number.
But it's been solved, so.
Oh, good.
she's really wonderful. I do want to point out to you, if you look at 2019, the red bar, no data was available. But if you look immediately below that, under the medical and total claims, you can see, especially on the medical column, starting in February of 2020, March and April, the claims were down. Now, we did come back in May with some claims, but then June was also a relatively low month. That was the impact of COVID. So a lot of people just didn't go to the doctor from February, March, April, May. Then we were, of course, talking to the medical community, and they were starting to see the demand return to pre-pandemic levels by mid to late summer. There's still, if you talk to the hospitals, they still have not seen it completely come back. And there was a lot of elective procedures. People were scheduled to have hip and knee replacements, different things. They just didn't have it done. So one of the things we're trying to figure out now, and we're watching the data on, will that come back? And if so, how much? And so you hear in our business people talk about the post-COVID bump when people come back. I think for almost 90 days, you can even go to the dentist unless you had a really bad toothache.
February, March, and April were terrible.
Yeah. So we're starting to see with the vaccinations that people are feeling comfortable again. The outpatient healthcare demand has returned to pre-pandemic levels. Some inpatient has, but for the most part it hasn't. So those are things we're kind of watching. One of the things that's also a concern, during that early COVID period, when people were just not going to the doctor, you had folks who were skipping screenings for whether it was a mammogram or an adult physical or a colonoscopy. And so we really want to encourage people to get back, get those screenings, because we're afraid that we're going to find some disease that progressed during that period, that maybe if we had caught it earlier, we could have treated it more effectively. So those are just some things that we're hearing in the community. So we did have that bump in the early part of 2020, but even with that, we ended up for the year, as you can see at the very bottom, with a 96.4% loss ratio. That's not good, and that's why we got the increase that we did last year. The good news is, if you look at the first 3 months or the first quarter with Cigna, we're running really well. Now, there is a lag between when you go to a new insurance company, all they're paying are claims from January 1 forward, right? So everything that happened before that is Qual Choice. So you do have a lag there between a claim, when a date of service, when somebody goes to the doctor, they're in the hospital, and the claim is actually paid. So some of this first quarter utilization is probably due to the lag and when claims are actually incurred. And so as we move throughout the year, that lag will catch up. And also, when you start the new year, everybody has a new deductible. You get halfway through the year, especially in the fourth quarter, people have met their deductibles. And so if they're having an elective, if they're waiting to have an elective, they may wait until they've already met that deductible. So it tends to level out throughout the year, but right now it's looking really well, so we're happy with that. Any questions on the claims history? Again, Claire did a great job going back all the way to July of 2015.
I I would like a copy of that comparison between Qual Choice and Cigna.
Oh, no problem, actually,
Just, you can send it to me on email.
yeah,
I'll get that to you.
for sure.
Does anybody have any questions?
I'm going to point out one more thing. You'll see on this report here where it says no data found. This is the large claim report for Cigna, and this is for claims exceeding 10,000. There is none, and we're only a quarter in, so we don't have any large claims yet. And then you can see the next page details the actual experience for the first 3 months for Cigna.
Give me a little bit on that.
And then behind that is the large claim report for Qual Choice for 2020. And you can see we did have 3 claims that exceeded 100,000 each. The top one was for end-stage renal disease. And then they had cancer, and I'm not sure what that other one is. I'll have to Google that.
Yeah, it's out of my vocabulary.
That's out of my vocabulary.
That's for medical director.
Yes. We do have a medical director, and we do have 2 pharmacists on staff that review this data with us. Most of what we see here is pretty common in groups. So nothing there, but you can see this is really what contributed to that high loss ratio in 2020 was a number of large claimants.
And do keep that Qual Choice one in the same spot, since it does have conditions on it.
Doesn't have anybody's name,
No.
but in a community the size of Mississippi County, y'all know each other.
Yeah.
And so,
So the rolling 12, that's, the loss ratio right now is 81%, is that right?
Correct.
right.
Okay.
And-
But what's normal?
That's pretty good. But if you look, the rolling 12 months is the 12-month period through March of 2021. And so those 3 months in 2021 really brought that down.
Right, no, I do see that.
Yeah.
Yeah.
So, I mean, we'll keep our fingers crossed and hope that things continue to run well, and we don't have to change insurance companies for 2022.
Well, and even the pharmacy, you'll see it's kind of back to where so toward the end of 2020, we were around that $24,000-$25,000 range per month in pharmacy, and then by March of 21, we're back to 26,000. So everybody
Yeah.
is back to filling their prescriptions.
Pharmacy did not have the dip that medical did through COVID because people were still getting their prescriptions filled.
Right.
They just weren't going to the doctor.
Do you have is there any kind of report that shows the actual number of members that met their deductible?
We can get that.
We
Yeah.
should probably mid-year, we can get a lot more reporting.
Okay.
More so when like June has been collected. And actually Cigna's pretty good. So they're by state law, they're required to provide certain things, like that claims versus premium report.
Mhm.
And then it sort of varies by carrier.
What-
But Cigna's pretty good. So farther down the year, we'll have more
Okay,
data.
okay.
What is the deductible?
$1,500.
Okay, that's acceptable.
Yeah, we see a lot of groups with.
County pays 1,000.
Hmm?
It was 25, county pays 1,000.
I've got people that got $3,500 deductible, 2 of them together, I'm like $50,000 a year,
Yeah.
so.
It's not
Insurance
uncommon.
doesn't, no good.
And we matched, when we moved from Qual Choice to Cigna, we matched the plan. And there were a few changes, kind of, like I mentioned earlier, very detailed changes, but they were improvements. So
$1,500 per person or per family?
Per
per
person.
person, I think that's 2 times, let me check.
Verify that.
It's, sorry. I misspoke, it's 1,000. And it's the 3,000 max out of pocket, 9,000 per family, so it's 1,000 3 times. So if you had a member of 3 people, it would be 3 times. If you had a family of just 2, it would be 2 times.
So that's the claims history, 2020, and then what we know about 2021. One of the things that Cigna does that we like is they provide a money for the employer to do some wellness incentives. And so they have set aside
$10,000.
$10,000 for Mississippi County to spend on some wellness initiatives. And
Yeah, so Kelly and I have met with Cigna a couple times talking about this wellness fund that they have given us. So part of our renewal, they gave us $10,000, and they have different restrictions around that $10,000. And so Kelly and I have, we've talked extensively about what we think might work for you guys. So this is all subject to change. We want some feedback from you guys today. But at the moment, if you'll look at that second packet, what we're thinking is we would like in June to encourage everyone who's willing to register for mycigna.com. And if you'll look at the next page, you're going to see some of the things that we could include with their paychecks about Cigna.com, the MyCigna site. So if we can get some folks to register for this, they're going to be able to use it to find in-network doctors. They can, of course, do that on the phone. They can also see cost estimates. So sometimes I'll walk somebody through how to register for this when they call me, because they'll say, Claire, I'm getting a colonoscopy. I've had colon cancer, so that would mean that they're going to have to pay toward it. It's not any more of that ACA stuff. So I can get them to log into Cigna.com. We can actually look at the providers. We can look at the average colonoscopy with this person is this much, is this much with this person. So it's a great website. They can compare quality scores. They can also access their explanation of benefits, so they can see where they're at with their deductible and their max out of pocket, just all those different things. So it's something that we'd really like to encourage the employees to do, just to take some control over their health care. The other thing that we would like to ask them to do when they log in is there is a health risk assessment that Cigna has loaded on the site. We can do that via paper if we need to. We just won't have as many reports if they do it via paper, so we really want to try to get people to do it on their website. If they're willing to log into the website, they're going to be more willing, to do that. It takes 10 to 15 minutes, and it's just asking them questions so that we can get a better feel for this wellness fund, what maybe in future years we'd want to use the money on.
Oh, okay.
So for this year, we're trying to take it real basic. Let's just try to get people involved. Let's incentivize them to go get a preventive exam, go see their doctor, do one of their age-appropriate screenings, whether that's a mammogram, colonoscopy, just diagnostic blood work, all those good things. So those are kind of what we had in mind for our first kickoff year of the Wellness Fund. Let's just try to get people involved. If they do those things, we can select, as a committee, we can select where we want the gift card to come from. So essentially what will happen is Mississippi, let's say we choose Walmart. So if you do both of these two things, you get $50 to go to Walmart. If you do one of the two, you get $25. And then at the end of the year, we can dole out either $50 or $25, and Cigna reimburses the county. If there's money left over, because we know that typically, Cigna let me know typically the first year they see 25 to 30% participation, okay? So most likely, we're gonna have some money left over because not everyone's gonna do this, okay? So if we have money left over, we were thinking hopefully by December, we might be back to some semblance of normal, we hope. And we could host a lunch, serve somewhat healthy food, maybe bring in some Subway. Cigna's not gonna pay for pizza. But we can try to bring it, unfortunately. So we could try, yeah, I know. So we've got to bring in something kind of healthy, and we could have somebody come talk to the group. We could use, who's willing to do those health risk assessments, we could use that information. Maybe people are saying, you know what, this year I'm just really stressed. So let's talk about how we can manage stress. We can bring in somebody that will talk to them, just about different things they can do. Maybe we have people that say they're suffering from insomnia. We can talk about sleeping habits and things. So we'll just kind of gauge it. Or, if you guys are hearing things in the community, things that you think would be a good topic for us to talk about. So it's all flexible, but this is the basic framework that we wanted to propose to you guys for this first year. As we go in, there's a lot more we can do with this, but we figured for the kickoff year, let's just try to get people to register. Let's get them involved. Let's get them to take some control of their care. The rest of this packet, I'm not going to read through it all to you. I just wanted you to have it. So these first two flyers are all about that MyCigna website that we really hope people will consider using. And then the next one, it talks about that health risk assessment that we're hoping that we can get some of the folks to do so that we can do a better job with this wellness program to see what people really need. And then the green flyer you see, that's about the preventive care. So when we finish this June initiative, we're not going to announce, if this is accepted, we don't plan to announce the July price, because if we hope we have great participation in June, but if for some reason we don't, maybe in July we make the reward $30. So we have that flexibility. So we don't want to announce the price just yet. So let's get through June, let's see how people do. And then we can announce July. We can include this with everybody's paycheck, kicking off. If you go to the doctor by the end of November, you're going to get $25 to Walmart or whatever. If we decide a different store is better, that's fine too, whatever we want to do. And then this last packet will probably come more into play next year after we've kicked off this wellness initiative, that we can get more involved. But we didn't want to overwhelm everybody with too much too soon. Just ease them into Cigna, get them familiar with the site. So any questions for me? I know that was a lot of information. What do you guys think about getting everybody to register and then rewarding them for going to the doctor? Does that sound? We're trying to pick something that's impactful, but we don't want to create too much additional work for Kelly and Beverly. We know they're really busy. So some of these initiatives that they have available are very hands-on, and we definitely want to be impactful, but we want to be respectful of their time too. So.
Go ahead.
Go ahead.
I was going to say, is this up to the committee to choose what kind of card we're going to give to the
Yeah, we can choose. I don't think Cigna would be open if we told them we wanted to give, Pizza Hut gift cards. They might have a problem with that. But, basically what will happen is Mississippi County, we will get all of our data. We will determine, okay, these people earn 25. We could do it separately. They let us know that some companies, maybe at the end of the June one, would just dole out the gift cards then, or some companies might wait for the preventive to close and then just give them one $50 card. So it's really how you want to do it. There's flexibility there. But we could do Walmart. We could do just whatever you guys think would go over best.
Does anybody have any suggestions? Does anybody have any questions?
Biggest problem we're gonna have is most of my patients are old farts like me. They don't know how to use a computer, so we might do something.
Yeah, some people do Amazon, but I feel like Walmart might be, everybody likes Walmart. You can get anything you pretty much need at Walmart.
That's about all we got at Walmart in the south end.
You could do a restaurant or something, but it seems like everybody can find something to buy at Walmart.
Yeah, they can always find
Whether it's groceries.
something
Yeah.
healthy.
Whatever you need. Yeah.
Frozen pizza.
Frozen pizza.
Unhealthy food. Oh, I was thinking of candy, Yeah.
So,
I have a question about the gift cards. Why not, instead of can we just make it a gift card you can particularly use anyway? And just
We could-
not
we could do-
restrict it to Walmart, so.
I think Cigna we'd have to check.
Can we-
Debit card.
We didn't ask them about like a Visa gift card.
Like a Visa gift card.
Yeah, we didn't ask them about that, but I
You
think.
can use it anywhere you
Yeah,
want.
Right.
I think that's a great idea.
I'm sure that would be fine.
Yep. Because essentially the county, we're gonna get this, once we all come to an agreement, we would get this approved by Cigna. And then once they give us the approval, we would just send them our receipt and they would reimburse the county.
You might want to stop somewhere else.
We might buy gas.
Yeah, you know,
What
Yeah.
about gas at
Oh,
Walmart?
no, you got to buy electricity.
that's what I'm saying. You can't find it
I
at
mean, Walmart really is, and sometimes, and there's I wonder, so if there's a fee on the card, does Cigna pay that, or does that come off the gift card?
It would come off the gift card. That's,
So-
I think the Visa one might have a.
It does, so the Walmart, I don't think has a fee, so they would get the total amount, I mean, it's not much,
I
but
was
a
just
couple of
saying,
bucks is a
yeah,
couple
if you
bucks.
just used it, was doing the just general use for anywhere, that's all.
So,
Okay.
I'm fine with these incentives work. Is there like localized data that these incentives actually do work? Like, that they cause people to go to the doctor more? Just out of curiosity.
Yeah, especially first year, it's tough. because you're introducing something, and we do know that one of the things that we really encourage people to do, one is to have a primary care physician and to get your age and gender appropriate screenings. Like we talked about earlier, we know if we catch colon cancer at stage 1 or 2, we've got really good potential outcome. But if it's stage 4, sometimes not so much. So the problem with that too is you don't hear about the heart attack you avoided, right? Because somebody got screened. And so it's just important for all of us to know what our health risks are and to get an annual check.
Mm-hmm.
But can I tell you that this program is going to materially impact?
What else can you do though? I get the incentive approach. I just wonder if it's like proven to work. It's like, what I would be worried about is that some people here, let's say they're independent contractor, it worked for me not going to the doctor to keep my job because I could get fired over $25 I'd get a Walmart.
Right, yeah.
So that was just the initial thought, but what else can you do? I mean, the incentive, you have to get people there, and it's hard to make a tangible benefit.
I can tell you at Stevens, we have about 1,200 employees, and we have an incentive that if my wife and I, because she's on my plan, if we both get our adult annual physical by September 1st, I don't have to pay any premiums in December. So it's a Christmas premium holiday, and I love it. Because, there's not enough money in the world at Christmas, right? And so that we do that for our employees. And we've had some instances where people have found health conditions they weren't aware of that needed to be
I
addressed.
love it because my husband doesn't like going to the doctor. When I told him he was going to get a month of free insurance, he said, "Where do I sign up?"
That's a great idea. I mean, that's a good idea.
That's a really good idea.
Yep. So this is subject, we can do something different. Kelly and I were just trying to think of something that would really, we definitely want people going to the doctor, so if it takes a $25, or you guys might tell us, nope, we just want to focus on going to the doctor. So these funds are yours to choose what we want to do with them. This just seems like a good introduction.
I think the My Cigna I think it's a good idea. The ones I've seen in the past are very user friendly. It gives you a lot of information, which could cut down on the calls and even maybe some of Kelly's time. Because they can find a lot of this information, like you said, doctors and how much a procedure is going to cost.
Or like their explanation of benefits. Like if they call Kelly or I and want their explanation of benefits, we can't get that for them. You guys are fully insured. We don't have access to their information. So if they have access to this site, they're going to be happier because they don't have to wait, call, get it remailed, all those things. So if we can get people on that site, it would be very helpful. And then if they have a hard time finding it, I'm happy to talk them through it. I'm sure Kelly would be happy to try to bumble
That's
through
what I
it
was going to ask, like Dr. Collum made a good point. A lot of people aren't really used to using the computer. So
Sure.
Can we help them, or can they call you? Or
Yeah, no,
just to walk them through getting
sure.
signed up. And
Oh, yeah. I've already asked Cigna. I anticipated that question. I said, I'm going to need either a dummy account, because we don't have Cigna, but I need...
Uh-oh.
No,
Did you
no,
hear
it's
that?
good.
They don't have
No, I just don't have access to their website because I'm not a Cigna member. So I said I need a dummy account so that I can see it as I'm doing it, or I need a video so that when people call me and say they can't remember where to click, I can say, hey, there's that green button, top right of your screen. Do you see it? So, and it is, I checked with Cigna, it is mobile phone friendly. So they can use it, if they've got a smartphone, they can log in on it.
Sorry, I was talking. Would this help if we stay with Cigna next year? Wouldn't this help with the renewal process as well? Wouldn't they be able to kind of?
Well, like at the end of the year, they could see, where they're at with their deductible. I mean, these sites with the carriers to see their explanation of benefits and their deductibles, they're so helpful. Or they're not sure that maybe the doctor bill is hit yet, they missed it in the mail, all those things. So
I think it's a good idea.
She's right, the merry-go-round that
Back and forth.
these people have done in the county is terrible from a patient understanding standpoint, from guys like me standpoint. We got somebody this year, somebody else next year, and twice in the last 15 years, the insurance company's gone broke. And who gets busted? The kids that work for us.
Right.
And they're the ones that suffer. So, as I said when I started, I'm not so much interested in premium shopping
Sure.
as I am in keeping deductible down. Because, you know, if you take home $900 a week and you're gonna get hit $100, that's fine. But if you take home $900 a week and you got a $3,500 deductible, then it's not manageable.
We completely agree, and just in the end of full transparency, we were not the consultant those 2 years the insurance company went broke. Sure. I want to get that out on the
Just
table.
go ahead and say
okay?
that loudly.
But I agree with you. Every year we go into renewal negotiations on behalf of our clients like Mississippi County with the goal of keeping the same company, assuming that they're good.
Please, thank you. That's what I.
Because we don't like it either.
No. And
But
last year,
sometimes the cost is, you know.
it was very expensive.
I'll have to,
Well, we're,
I'll have to sit down and read that. It's too much information.
that's what we
I
can
guess-
do to help the people that have been burned by our situation, but renewable, like she says, and I can call you if I get in trouble.
You can.
Okay? I stay in trouble all the time.
I might not be able to get you out, but I'll sure try to help.
Just come visit.
Well, Aaron, I'll make a motion that we go with these two suggestions for the wellness incentive to do the My Cigna campaign in June, and then also the preventative exam.
That's what I was about to ask.
Second motion.
All right, second. All right, we have a motion and a second. Would anybody, all in favor? All opposed? Motion passes. I believe we're gonna have to send that to the finance committee so they can decide whether they would like to appropriate the funds or clean it up at the end of the year.
And our last piece, everybody, and Kelly, I don't know if you want to speak to this. Our last piece is the 1094, 1095 reporting with consolidated administrative services.
Just a little bit of background. The Affordable Care Act requires employers to provide some reporting on what employees were covered during the year. And you know, when you file your taxes, you have to provide that form also. And so this is just the service that they would provide to make sure the county was in compliance.
Who do we currently?
Kelly.
Yay!
And I could still continue to do it, except we switched software companies, and this new software doesn't have the capability of doing this. So I would literally have to set in a typewriter and complete 250 plus forms. And so I don't see how that's possible. But we already contract with Consolidated Admin Services for help with COBRA and FMLA. And they also offer this, and several other counties use them. Basically, to me, this quote was a little confusing, but basically, if we had them do everything, so they would send us a spreadsheet, and we would give them all the information on all of our employees that required one of these forms. We would send it to them and tell them hire dates, term dates, coverage dates, give them everything. So there's a little bit of work to it still, but for them to combine all of that information, do our 1094, do 1095s for each employee and submit it to the IRS, it's going to be approximately $1,700 to $2,000. And
Per year.
per year. And so, you know, they are, I think this past year, the date was March 31st.
That sounds right.
Yep.
So, you know, it won't be until next year, but if we don't get on their roster
Right.
of, you know, then they can't just add people at the last minute. So, you know.
I think, the $350 per employee, that's a reasonable amount, I think.
And they can do it $350 per form, and then they can send them to us, and then we can mail them out. Or
okay.
we can pay the extra $2 per form, and they can mail them for us. So, you know, either way, we can do either way. You can save a
Yes,
little bit
that
of money.
makes a little bit more sense. That's what we do. We just pay them to mail them.
So I'm guessing, I guess the question is, what does the committee want to do? Do we want to, use them? Do we want to use them, or do we want to consider options?
I want to do what Kelli wants to do.
Yeah.
She's the one that has to.
I'm
Yeah.
all for that.
Well, they have been wonderful for us in the FMLA area and the Cobra area. And Carrie has been extra helpful. She even helped me with
She did, yeah.
the 1095 last year and she didn't have to. I had questions that I didn't have anybody to help me with, so she was even, nice enough to offer that. And, I mean, I like them and I think that this is a reasonable price. When you think about the hours that you spend to do it and, the postage and just, the printing, the toner, everything. I don't think it's a bad price.
We outsource it. I mean, I feel like it's and then, and they guarantee the compliance and,
Yeah.
I mean, to me, it's money well spent.
You want them mailed out also?
Well, I mean, postage right now is 51 cents for us. If we mailed out 250, I mean, we're going to be close to that.
Let's go ahead and let them do it too.
I make a motion, we let them do it all.
Yeah, we'll make the motion for
We have a motion,
everything we done. Second it.
second. All in favor? I guess motion passes.
They said it at the same time. They said it at the same time.
I've got
Maybe next year,
Oh.
because we won't pay it till next year.
That's right.
I just want to be able to let them know to put us on their list.
I think they asked for some reporting, maybe quarterly.
Oh, okay.
So that's probably what she's getting, is that they like to collect,
As we go. Yeah, that would be easier for me too. But I don't think we pay, right, until.
No, I don't think so.
All right. One last piece of information I wanted to share with the committee. I wanted to update everybody on the current unpaid claims lawsuit.
Yeah, that's all we're interested in.
I spoke with Mr. Thomas 2 to 3 weeks ago. He informed me that they're going to mediate sometime this summer. And it's looking like the lawsuit will be over with next March or April.
Because I'm going to interrupt you in a minute.
No, it's fine. And he did get back with us on providing a list of all the claims, the unpaid claims. The list shows what employees owe claims and who they're owed to. And we're in the process of contacting those providers. The insurance, or Gerber Life, negotiated a price to pay to these providers. And Mr. Thomas has suggested that if those providers will take that negotiated price, we can pay it without damaging the lawsuit. He did say that if they won't take the negotiated price, we shouldn't pay it. That's where we're at right now. Kelli and her office have been making phone calls. Have y'all got any further with that?
We started making phone calls in late March, and then we ended up getting some questions back at us that we didn't know how to answer. So we kind of stopped and we checked back with Jeremy Thomas and cleared all of that up. And then at the beginning of April, we started new software. So we haven't got back to that yet. But the providers that we did talk to were very willing to take the negotiated price.
I can't imagine them not taking it.
So do we have a total on that?
The negotiated total was $658,000. We thought it was $653, $658. The original total was $1.4 million.
Right,
Well, okay.
right. So that was probably the cash price amount that we were looking at that 1.4 million.
But like I said, that's where we're at with the situation. Does anybody have any questions?
And so we're hoping that through the mediation, we'll get that 600 back?
Well, if we get that much back, we'll get most of it. According to Mr. Thomas, he thinks we'll get most of it. He said maybe even all of it, but, yeah. So,
I understand litigation next month. Okay. How quickly can we find out what they'll accept
Either way.
negotiably and pay it? The county pay it to take the load off of these people that work for us.
as quickly as we can get
Right.
these phone calls taken care of.
Yeah, there's 1,200.
1,200 claims.
Oh, I know, I got a list of them.
Yeah.
Why does Performance Health not help you? Weren't they paid?
They sent the list of claims to us.
Oh, yeah, but they didn't help us claim.
Exactly.
I don't know, I mean.
There is a way to make Performance Health give you this information, and there should be a way to make them help you negotiate a settlement. To take it off of your back and our back, here we're doing the work that Performance Health should have done in the beginning.
And see, that's one of the questions I had for Mr. Thomas, and it may have been something to do, this from him, with the lawsuit, that kind of
Well, I just,
stepping back from
I'm
it.
not a
Once
lawyer.
something's in lawsuit.
I'm not either.
But
Yeah,
I don't
once
know.
something goes into a lawsuit, a lot of companies are like,
They want to
I don't
step
want,
back
I'm
from
not
it.
gonna touch it with a 10-foot pole because I don't wanna have my name in that, so I can see that.
I just feel like the people we're trying to protect are still left with their pants.
Exactly.
Right.
And that's why we're trying to move forward as fast as we can. I will call him and ask that question.
Because we've got,
Again,
3 people here that have filed bankruptcy because of this. One of them's gonna lose her house. A young couple. And
Yeah.
folks, I've been on the quorum court since January. This is almost May. Come on now. I don't think we collectively have made the people that should be helping Kelly do what they're supposed to do.
Are-
I
Dr.
just,
Collum, are you talking about like actual people who have contacted you and told you that they're gonna
Yes, ma'am.
lose their house?
if they're gonna what now? Oh,
That
I've
they're gonna
got,
lose
I've
their
got a
house
list of
over it?
people here well, I can't read their name out loud, but I
Right.
can tell you the ones that have filed bankruptcy that don't mind them. That's a matter of public record. And, that's a little tough, you know? 'Cause we
But
don't,
there's- but there's no
think the
stopping it at
basic
this
pay
point,
of
right?
employees in this county.
Yeah, so what are they?
I mean,
We
is there
did
any
not
way for us
protect
to stop that at this point, or is it too far gone for, I mean, have they
Oh,
already
no,
filed
this
bankruptcy?
is already done.
So, well,
I
okay,
wait
so
on the
then we
house, I
wouldn't
don't
pay
know,
those
but on the
claims.
bankruptcy, that's done.
Okay, but I mean, if there's something that the county can do to keep
I mean, I'm
someone
not
from
trying
losing
to-
their home, I think that's something that needs to be brought to the table.
And, you know, gang, we've been talking about this again since January. Here we are, almost May 1, and
well,
we've done nothing to relieve ours.
to honestly be honest,
Okay.
I
can't beat them out.
mean, it takes, well, it took 3 weeks to get the list alone, 3 or 4 weeks.
See, that's where we should have hammered Performance Health. They could do better than that.
Well, I called back and I said, did you hear from them? He said, no,
good point.
I haven't heard from them. And he said, I'll call again. He called again and we had the list in 3 days.
Well,
Wow.
the reason I say that is I have a good friend whose wife has been in medical collections for 35 years. She's made her living doing that. And she's the one who gives me my information that you can make these people give you the outstanding balances, and they got a premium paid, and they should be able to negotiate a settlement. I'm gonna take a hit at lawyers. Remember, they get paid by the hour, not by the job. So we need to get somebody to do it. I don't mean that ugly. I'm just, I don't know. I guess I'm just worried about the people. I doctor on a bunch of the poor folks, okay? And the poor folks are the ones getting kicked right to sleep with our situation. That's the reason it's important to me that we have continuity and we don't do this again. Because this is not new to us. This has happened twice in the last 10 or 15 years. I believe I'm right, Kelly, at least 15 years.
Yeah, Michael knows more about the date, but you're right.
But
We stepped in the first time and helped clean it up. And it was Great West, I think was the name of the deal. And then
I know well because it burned badly.
this,
I was by myself. I mean, I wasn't working with somebody. I was,
yeah.
I was by myself. And it wasn't anybody's fault. It wasn't the people's fault. That wasn't, you know, it wasn't their fault at all. Anyway, I'll shut up and let you in the meeting.
I will,
One last thing, just before, I mean, I'm agreeing, but if they've moved into this and this is already a done deal, I mean, we should definitely talk with Jeremy. I mean, if they filed bankruptcy and it's gone through, there's not
Yeah, you
any
could.
reason to,
Pay their
there, and we shouldn't pay their claims.
Well, I agree.
I mean, that's a good point. The county, there's no incentive for the county to pay those claims at this point because.
I don't mean that, I'm not trying to be wrong.
I mean,
I mean,
Too late.
unless it's,
I understand where
yeah,
you're coming from.
That's why I was asking.
unless it's gonna take their bankruptcy back, I mean,
And I do that.
no, so,
I will,
It's a shame we let it go.
that's right, that's right.
I will contact Jeremy and bring up that question and your question. If there's any
I
way
can
we can.
interject on that real quick. There is still an incentive for the county to pay if we could be liable to them if we don't. But they still took a credit hit, so there's legal damages there. So there's still some incentive to make sure they at least have like a waiver or something.
So in your opinion, should pay.
I'm not saying we should pay them, but I think there's an incentive that we get a release of liability or something. So that they took a legal game and said into their bankruptcy.
No.
That's their
Well,
credit.
I'm not a lawyer, but I don't understand why we worry if we pay something, if I pay something that he owes, okay? Does that mean I don't have recourse to get my money back from him?
If they didn't do any claim. So that you can get recourse from it. But if we just don't pay their claims but pay other ones, that's for sure like exposing us to liability from that insurance lapse in 2019.
You and I wouldn't understand.
And I would be really worried about.
Well,
I
that's
kind of
what I'm
understand what you're saying.
Yeah, that's what I'm saying. I feel like we should we should do some further investigation, but just not start paying, you know.
Oh, I think we need to know what we're paying for, and I think we need to know what they'll settle for.
And we may need to just, I know there's 1,200 phone calls to make. I mean, we should probably start with probably the bigger of the bunch and the most, you know, the most emergent.
I don't think you call the people, I think you call these people.
That's what I mean. I mean, that's what I'm
And they
saying.
should tell us what, and then we should be able to clear out the bills. I think we can afford that. Clear out the bills, get them off these people's back. How would you like to be 25 years of age, married, try to buy a house? So this ain't no good.
No, I mean, I'm with you. I agree
We can't do it.
completely.
I will contact Jimmy Thomas.
Call me if you need me.
I need to get
I
your
promise
number.
I'll shut up. You can do it.
Does anybody else have any other suggestions? Questions? Entertain a motion to adjourn?
Motion to
Any-
Yeah.